Hey everybody, Dr. Baker here. Welcome to Living as Intended. With me, Dr. Benulis. Nobody can pronounce Benulis, so it's Dr. Ben. Dr. Ben is a chiropractor, just like myself, but has gotten into autoimmune disease-related things. He's got an awesome book I want to talk about today, and he actually was able to reverse his own autoimmune disease, which is something most people are unable to do. So, Dr. Ben, welcome to the show. I really appreciate you being here.
I'm super stoked to be here. I know we've been like ping-ponging for a while trying to get this going, so I appreciate you booking me, and I'm really stoked to be here.
For sure. First of all, let's talk about what was going on with you when you got diagnosed with an autoimmune disease, and what was that experience like? And one of the things I want to go into is, because you were a chiropractor, were you a chiropractor at the time?
No.
Okay. So you didn't necessarily know the stuff that we know now. So I want you to walk me through what's that like to get that diagnosis? What's that like what was going on with your body? What led you to going down that path?
Well, yeah, just to give you some background. So previous career, I was working as an engineer in the microchip industry, and about like 27, 28 years old, just started having health problems, kind of seemingly out of nowhere. Started developing like eczema, rash stuff all over my hands. Started developing like really bad chronic fatigue where I was just tired all the time, had no energy, was like knocking back Monster energy drinks just to get through the day. Had really bad chronic muscle pain where just everything hurt all the time for no reason. Like it felt like I had always worked out the day before even when I hadn't. And then had just really bad digestive issues where it was like every meal I ate was disagreeing with me. My digestion on the back end was terrible. We don't have to go into details on that, but on the front end, I was having stomach issues too, and it was just a constant battle. I was popping like over-the-counter medication all the time. I really had no concept of anything health. I'd been thin and normal my whole life. I just thought, I got good genes. I can eat whatever I want, and it's okay. And I didn't really actually get diagnosed with anything. That was part of the problem, was that I went down the standard medical route with these kinds of symptoms, and basically just got the runaround. Got told like, you got muscle pain, we'll send you a rheumatologist. Oh, you got skin issues, we'll send you a dermatologist. Oh, you got digestive issues, gastroenterologist. And each one of these guys is like, well, I ran your blood work and everything looks normal, or we can't figure out what's wrong with you. Just take over-the-counter stuff. Oh, gastroenterologist, could this have anything to do with what I'm eating? Oh, no, diet doesn't affect anything. It's all about me cutting parts out of you and drugging you up. And I went along with it in the beginning because I was like, oh, these are the doctors. They know what they're doing. Like, they're smart. They went to med school. They know stuff. I got to listen to them. I got to do what they say. And, each one is like passing me off. I can't figure it out. I'm going to refer you to this guy. He's really good. A guy who's really good sits down with me for 5 minutes, goes over my blood work and goes, I don't know what to do. I'm going to send you to this guy, right? And so, like, I'm just getting, like, the runaround. I don't get a diagnosis? Are you kidding me? No. I just get a lot of blank stares and shrugged shoulders. And so, after about maybe, like, 6 months of this, I'm kind of realizing, like, maybe these guys aren't all they're cracked up to be. That, like, they can't figure it out. And I really thought at the time that I was just some special case. That was like the one guy, the one in a million that was the medical history, right? And come to find out, later on, it's like, no, this happens every day. This is how the freaking system works, And so,
real quick, Doc, I quick question for you. How many doctors would you say you went to get zero answers?
13 or 14, if I had to guess.
So here's the thing, and for anybody watching, if you don't understand what chiropractic is the only profession that does not treat anything. We simply remove interference so the body can heal itself. And that alone, I talk to my team all the time, and I tell them, hey, listen, we have no competition in this office, because if you think that the medical system's competition, those guys are a friggin' joke. You can go to 13 doctors, get zero answers, and that same person, right? I want to talk about nutrition today. I want to talk about the plant-based diet and nutrition that you do. I want to talk about all that. But also, we can't skip past the fact that if you simply get pressure off the nerve system, your body will heal and function at a higher level. And these guys, that's just like, there's no way that the medical system can even comprehend that. So bottom line, we always, as chiropractors, have to remind people, listen, if you remove interference, your body can heal itself. That's the premise and the basis of everything we're going to talk about today with nutrition.
Yeah, absolutely, 100%. And I had no knowledge of this at the time. Really, like, medicine was treating me as like a series of problems that they need to fix, right?
Right.
And so when they couldn't figure out what the problem even was and even diagnose, they just go, oh, well, we don't know what to do. Herb the dirt. Must be all in your head, right? Must be, you must be a mystery case, right? They just sort of like, if they can't figure it out and they don't know what it is and wasn't taught in their little med school book, it might as well not exist, right? So treating the whole person, treating you like a human being, forget it. So that's when I just sort of had to, open the side hatch and unbuckle the seatbelt, kind of tuck and roll out, and figure it out on my own. And that's when I started looking at everything alternative. And I had been like the biggest devotee to like the pharmaceutical medical system. I was in a biotech like high school program that was like a feeder for big pharma, Ivy League educated. Like I thought medical doctors were God. And after this experience, I was like, wow, they can't help me, right? And I'm still thinking I'm the one mystery case, right? And so that's when I'm trying everything alternative, herbs, supplements, special drinks, this and that. And I remember reading stuff and saying, if you just eat more fruits and vegetables, you just eat a healthier diet, a lot of these problems go away. And I thought, not doing that. Like,
that's way too easy. That's too simple. There's no way just changing diet could fix it.
Yeah, like because medical doctors have told me, what you eat has nothing to do with how screwed up your digestion is. And so I really believed it because that's what I was told. But then it kind of got to a point where I was getting worse and worse. Like the chronic fatigue was so bad, I could like barely do my job. I was like, my boss was telling me like, if you don't get your act together, you're gonna get fired. My relationship had gone down the tubes. It just felt horrible all the time. Really didn't have much of a social life. Really was just like hanging on by a thread. And it was like, I gotta get this figured out or I'm toast. I'm not gonna have any life to live. There's not gonna be any point to living. And so I was like, okay, I'll do the nutrition thing. Like I'll do it. And at the time I was just eating like a steady microwave diet of like pizza, burritos, Mountain Dew, whatever. And I was like, okay, well, what I'll do is I'll take that same approach and like use a blender, right? Because it's a lot like a microwave. You open it up, you throw the food inside, you close it, you push a few buttons, and then like a minute later, bam, you got food. And so that was kind of the mentality. Started making just like giant, smoothies of fruits and vegetables here. And much to my chagrin, it actually started to work. Actually started to feel better. And noticed that like I was just trying to get my stomach to not hurt, but then it was like, wow, I have way more energy. My chronic fatigue's gone. The pain is pretty much non-existent. The skin's looking better, like everything, and I'm getting real excited about it. And it becomes like this thing where it's like the more I do it, the better I feel. The more I want to do it. I became really evangelical about it to everybody. Like, oh, guys, fruits and vegetables, it's going to change your life. It's so awesome, And but what I noticed was that like everything improved, and I was sort of like one day I like just took stock of everything. It was like, damn, like 2 months ago I was in a world of hurt. Now I feel amazing. And like I witnessed my body heal itself firsthand, and that was like the major light bulb moment. I was like, no doctor did this. I saw like 14 of them, didn't get jack, didn't get a diagnosis, definitely didn't get any help. And here it was, I just ate differently, I just ate better, and then like I literally witnessed my body transform, and that shifted my whole paradigm. That was like, because we can come on here and talk and tell everybody, your body heals itself, just provide it the right conditions, remove the interference, just do the good stuff, and the body will do the work. And people are like, oh yeah, sounds good in theory, but when you like experience it firsthand, you're like, whoa, okay, everything I learned about like medicine and health and doctors is like actually kind of not actually right. And so that was big inspiration for me, because I was like, it was like, man, like I healed myself. There's all these other people out there suffering, couldn't get an answer, going through similar things, And like with 5 brain cells and the knowledge that I have, I can do better than the 14 medical doctors that I was, getting passed around on in 2010. And so that's when I decided to like go back to school. But I knew, it was like, I'm not going to learn freaking drugs and surgery only to say, oh, I don't actually do that, right? And when I was like reading about these other healing professions, and chiropractic was like, well, the body heals itself. We just got to remove the interference. We got to provide the right conditions. I was like, yes, that's it. That's the game. That's it. That's how it works. Body is self-healing, self-organizing, self-replicating, self-regulating. Just gotta provide it the right conditions, remove the interference. So that was the inspiration to do that. And so now I'm basically at a point where that's what I do full time, is help people create more health, remove the interference, provide the body the optimal conditions to heal itself. And then
question for you.
Do any of the work. Yeah.
How long? So after you started healing, you said about 2 months in you were doing way better. Did you ever go back to eating poorly? Have you just for that entire time been nothing but clean fruits and vegetables?
Oh no! I mean, in the beginning, I waffled a lot, because it was like I wanted to feel better, but I also really wanted pizza. I also really wanted, like Subway sandwiches and all that stuff. But I would notice the contrast where it was like I would be good, eat clean for a few days, notice everything starts feeling better, get a craving for some pizza, go indulge it, have a few beers, whatever, and then like symptoms come raging back and like way harder. Like every time it was like boom, it was like started feeling like getting hit by a truck. And so there was a lot of waffling in the beginning. It wasn't like, oh, I just did it and I was perfect forever. No, definitely not. But it was just like it affected me so bad. The contrast between like eating healthy and not eating healthy was so blatant and obvious. Like I went from feeling amazing, like a 10 out of 10 to like negative 10 out of 10. Like it was just like no brainer. Like I got to figure this out. I got to keep going. So there was a lot of mistakes and falling off the wagon in the beginning and just trying to get my bearings for sure. But health felt too good and unhealth felt too bad. And eventually I straightened out.
There's a component to it where it's amazing to me how much your body adapts to what you give it. And like you one of the things you just mentioned is like you would go for a while doing really, really well and you get to that peak and you feel amazing. And then as soon as you ate like shit, then eventually like right away you felt horribly. But what happens a lot of times with people is they eat like crap long enough and they might not have a flare up like you had. They may not have this massive autoimmune like to go to a negative 10 out of 10. What they'll do is they'll go to like a 3 out of 10 over a period of time. Like they feel crappy, but then they just stick with the pizza, the beer, and the microwave food, and it just slowly gets worse and worse, but they start to feel like that's kind of normal again. They forget what the 10 out of 10 feels like, and then they're right back in that spot. And because they don't have this massive flare-up, like punch in the face like you had, they leave it like that until 3 or 4 years later they've got a different diagnosis or they've got some other pain, some other problem, or they're 20 pounds heavier. I think that it's really cool, and it's amazing to me that the body it'll go, okay, you're not going to feed me anything besides garbage. I guess I'll start feeling as normal as I can. I'll help you feel normal, even though you eat microwave crap. But if you wouldn't mind maybe cleaning up a little bit, I can show you what great feels like. And that's where I think people get stuck in the eating like crap, is that over time it just doesn't feel as bad as it did the first day or two.
Yeah, they get used to being chronically unwell. They get used to being a 3 out of 10 and thinking that's as good as it gets. And that's where I was at. I mean, I was probably a 1 to 2 out of 10, and I was just sort of like, well, this is the hand that life dealt me, This is like, I'm just going to feel like hammered shit every day, excuse my language.
When you have people come into your practice, are you still in practice, or are you doing mostly helping people virtually online?
I do both, man. I love adjusting. You never get me out of that, so... Yeah.
So when the patient comes into the office, is it primarily focused on their spine and nerve system, and then depending on what's going on, invite them to do nutritional stuff, or is that automatically part of the conversation?
I kind of feel them out on that because not everybody's ready to make a change. And so, and it depends. Like, if they're coming to me with just like garden variety neck and back pain, it's like we can have that conversation, but the adjustment's going to be the thing that really makes the difference. But if they're coming to me with like lupus, ulcerative colitis, something like that, it's like, man, like we got to get both these things dialed, or you're not going to have a fighting chance.
Let's start talking about different types of autoimmune diseases, because I think there's over 100 different diagnosed autoimmune diseases at this point. Am I correct? It's somewhere like high 80s to 100s.
200 now.
Okay, way off.
This is the medical model, right? They just diagnose, like they put a label on something and they say, "Oh, I know what it is now, and here's a drug for it," right? Like,
well, if they've never seen it, they just call it, "Oh, this must be Dr. Ben syndrome," and so then they have a new name for it because Dr. Ben's the first one that they saw with it.
I mean, we operate in a health paradigm, not a disease paradigm. So it's like, to you and I, like, diagnoses are arbitrary, like they're meaningless. But yeah, to everybody out there, there's about 200 different diagnosed autoimmune conditions. Sorry to go on a tangent there.
No, you're good. And to play onto your point, like when someone comes into my office, with all due respect to them, and I love them and I want to hear them, but when they start talking about all this stuff the medical doctor has told them, all I hear is womp, 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 womp. And in my mind, all I can say is, you can get better. Let's figure out where the interference is, and you're going to be fine. So it's not like there's ever a question mark in our mind that people are going to heal, right? But I don't care what the diagnosis is or what they call it. It's called interference, period. But anyway, as far as the diagnosis that people are getting, I wanted to at least connect with people that are listening, that are sitting there saying, well, yeah, but mine's ulcerative colitis. Yeah, but mine's lupus. Like, because they've been brainwashed. And again, if you're listening and I'm talking to you, I love you, and I want you to understand that we're not picking on you because you've been stuck in this model and stuck in this paradigm for so long that you don't really see a way out. But these people that are listening to this that have an autoimmune disease, they think that because it's got a specific name, it's somehow harder to fix than the other one. So I want to talk about, can we touch on the fact that all autoimmune disease is going to respond essentially the same, or am I off with that? Like, someone comes in with lupus versus colitis, are we not going to do basically the same thing? They're both going to heal?
Yeah, I mean, if you think about it, it's the same root cause. It's the immune system attacking a certain part of the body. So, like with ulcerative colitis, it's attacking their large intestine. With Hashimoto's, it's attacking their thyroid. It's the same root cause. It's the immune system gets a wire crossed, starts attacking a part of the body. The good news is the nervous system regulates the immune system, right? So no matter what it is, how it manifests as symptoms, root cause for all autoimmune disease is essentially the same. It's essentially toxicity in the body that needs to be expunged. So, but yes, the medical system has gotten really good at indoctrinating people, brainwashing them to believe that, like, oh, you have a special disease that will never go away, and you have to be treated by this the rest of your life. Your immune system is bad, it's naughty, it's attacking you, and so we're going to put you on Humira, and we're going to suppress your immune system, we're going to suppress it so that it doesn't attack you anymore. And then when you get sick with other things and get cancer because your immune system isn't working as good, well, we'll have other drugs for that, so don't you worry.
Yeah, and so I think you and I are, what I'm about to say is contradicting what you just said a little bit, but I think we're on the same page. I don't think that the immune system has a wire crossed, and I don't believe that the immune system ever messes up. What I believe is happening is that, like you said, there's a toxicity in the body, there's something going on that the immune system has to respond to, and I've always used the analogy, like, listen, if your immune system is a watchdog and there's someone in the yard, that dog should not stop barking until that person leaves. Otherwise, it's a crappy dog. But you can't just tell the dog to shut up and go in the corner. That's what medical doctors do. The intruder's still in the yard, but they just tell the dog to shut up and go lay down. My point, though, is that innate intelligence, this power that's in our body that runs the whole show, it never messes up. It's always doing the right thing at the right time. So we're saying the same thing. I just want to challenge you, I guess, to say medical doctors say the immune system has a wire crossed and messed up, and that's their excuse as to why they need to poison it and put it down. Do you think it's really messing up, or do you think it's addressing something that still hasn't left, like that toxicity, whether it's a heavy metal or something wrong with your gut? You keep eating GMOs, you keep eating garbage. That's why it keeps attacking that, because it's a foreign material.
Yeah, I think so, and I think it gets it confused with something in your body. I think that there's another part of your immune system that would normally handle what it's trying to handle, but that part of it is suppressed. So it uses this humoral immune system as like a kind of a second like line of defense or like second strategy, but it's not optimal, and so there ends up being friendly fire. And, yeah, I'm a firm believer that like innate does not make mistakes. Like nature does things a certain way, and so I really don't want to like make it seem like the immune system's messing up. I think it's just using a suboptimal strategy because it is too like disempowered and too inhibited and too interfered. Distracted
also, right?
Yeah.
Because the immune system, one of the things that I learned is that any damage to the cell requires an immune response. So that could be damage from poor nutrition. It could be damage from some artificial smell or odor or whatever. It could be damage from actual physical trauma. But any damage to a cell requires an immune response. And so what if the person's creating so much damage with their environment, their lifestyle, that the immune system is literally so busy dealing with that it's not able to deal with optimally, like you just suggested, what's going on with the rest of their body, and that's why it's manifesting in the symptoms that are diagnosed as an autoimmune disease.
1,000%. And like you were saying earlier, it's like pretty phenomenal that we can treat this body as bad as we do, and it somehow hangs on and keeps us at a 3 out of a 10. Like, we don't appreciate that until we realize, man, I spent 25 years of my life living like that. So yeah, absolutely, I agree with you. Yeah.
I want to use that example real quick, Doc, because people will sit there and think like they won't have the trust. I don't want to say faith, because I believe in God, and I believe that God made my body and God's the one that heals my body. God's the one that gave me innate, but I don't want to make it about God for people that are not on that same page. But can you still hear me?
I can still hear you, yeah.
The bottom line is that it's an understanding, not a faith, but they don't have this certainty, if you will, in the body's ability to heal itself. Yet, if they look at it from a different perspective, which is, holy crap, my body's still alive even though I've been poisoning it for the last 20 years, that same intelligence and same power that put you together and has been working for 20 years and been poisoning it is the same thing that will help you get better from here on out.